The role of the dominance behavioral system in depression and anxiety. Brandy Mora. Depression and anxiety have become more pervasive in the last 20 to 30 years, with depression projected to become the second leading cause of disability by 2020 worldwide, and anxiety is among the most common mental disorders, affecting 18% of the population. The purpose of this project is to share information on how the dominance behavioral system may be linked to anxiety and depression. The role of the DBS can provide not only an understanding of the basis for these disorders, but also offer clinical awareness to enhance therapeutic work. The DBS is conceptualized as a biologically, psychologically, and behavioral-based system which motivates our need for social and material power or control. It is believed the human DBS system evolved from competition and the need to establish peace. High dominance behaviors and motivation may be related to power, but anxiety and depression are related to subordination and submissiveness, as well as a desire to avoid subordination. A literature review of DBS and its connection to depression and anxiety offers reliability and validity using self-measures. Observational methods allow for greater objectivity and help explain in detail how individuals respond in their environment. Allowing both reporting types brings depth and breadth to this research. In these approved studies, participants completed questionnaires covering both DBS facets and manic, anxious, and depressed behaviors. A compiled set of measures covering core DBS facets and characteristics was used to collect data from individuals suffering from anxiety and depression. Participants completed these self-report scales as well as measures of manic, depressive, and anxious behavior. Theorists have noted strong phenomenological parallels between mania and dominant behavior in literature. Connections have been drawn between manic episodes and bipolar disorder and displays of dominance in social behaviors related to status. In contrast, depressed people with bipolar disorder focus on feelings of inadequacy and have a subordinate and submissive self-view. Researchers list specific measures as having proven greater than 78% reliability. These measures often provide validity through the positive and negative correlations to shame, self-esteem, neuroticism, assertiveness, and leadership, with a focus on the connections between depression and subordination. In conclusion, the DBS is conceptualized as a biologically, psychologically, and behavioral-based system which motivates our need for social and material power or control. A literature review of research pertaining to the role of dominance behavioral system in depression and anxiety supports a connection between those facets and behaviors. Correlations between depression and shame, subordination, submissiveness, and avoiding inferiority were noted by researchers using observational methods. The findings support the connection between DBS and depression, but admit to some limitations in the studies relating difficulties with assertiveness to depressed patients. In the DBS and anxiety relationship, subordination appears to be a large factor in those observed with anxious behavior. While the authors mostly support their hypothesis, they relate limitations to the methods and call for more longitudinal future study with a focused population. The implications of the dominance behavioral system linked to abnormal behaviors could provide not only an understanding of the basis for these disorders, but also offer clinical awareness to enhance therapeutic work. Establishing the connections between anxious and depressed behaviors and subordination or submissiveness would help establish better behavioral modification and cognitive behavioral therapies for those diagnosed with anxiety and depression.